September 11th and Hurricane Katrina, two of our nation's most recent and most devastating disasters, revealed our vulnerability to the unknown and opened our eyes to the importance of being prepared. Here in Missouri, a powerful F3 tornado leveled part of the town of Caruthersville, and explosive storms and tornadoes severed power to 700,000 in St. Louis for days during a blistering heat wave. Let's face it, emergencies can happen anytime, anywhere, and being equipped can make all the difference. This rings true especially for businesses like yours that have the added responsibility of caring for others. And never will that care matter more than in the face of a real emergency. So, exactly how prepared are you? There's no way of knowing what type of crisis might happen or when it will strike, but there are 3 easy steps that will help you take control of any tragic situation, from a terrorist attack to a tornado. First, create a plan for your facility, your employees, and the people in your care. Second, prepare an emergency kit. And third, listen for information about what to do and where to go during an actual emergency. The program is called Ready in 3, and it will help you and your staff be ready for anything. The first step in emergency preparedness is to create a plan. Missouri licensing requires that you have an emergency plan for fires and tornadoes. But what exactly should your plan entail? Well, your emergency plan simply spells out what steps you will take and what steps you will teach your staff and residents to take in a crisis situation. No one else can write your plan for you because every facility in the state is unique. Let's hear how a few of your peers are ensuring the safety of their staff and clientele.
I think it's very important to be prepared. We're taking care of people's lives. It's just imagine if your mom was here. And what would you expect me to do as her responsible party?
What's important and challenging is the fact that a lot of people that are within long-term care institutions have a cognitive impairment.
We do fire drills so often they all just know as soon as that fire alarm goes off, they're out the door. It's very important and very good for that to be a routine thing for them, that they're so used to doing this that they won't even think twice if it really does happen.
We got to practice the drill a lot more frequently than we do in other places. And the reason why I say that is because the staff turnover rate in long-term care facilities is very high. So ensuring everybody is on that same page is important.
We have a sign-in sheet that as everyone walks into the building, they sign in for the day. And so one of the first things that one of our staff will do before they leave the building is to grab that sign-in sheet so that we can account for everyone once they get outside the building.
One of the men here at the house, he is hard of hearing. He also has beginning stages of Alzheimer's and has developmental disabilities. So one of the challenges with him is with the drills, him knowing what we're doing. Tornado drills will show him a picture of a tornado so that he knows what we're talking about, and then we can show him where he would go. One of the other things he has is a bed shaker in case he is sleeping and he wouldn't hear the alarm. Then if he's in bed, it would shake and he knows that's part of the alarm. He knows you have to get outside.
The challenges are mobility. With canes, with walkers, some with wheelchairs, that they're not going to be able to move as quickly.
Everyone before they left, we had name tags on everybody and on wheelchairs, on Jerry chairs, and charts obviously are labeled. Their pictures are in all their charts.
So we have faced problems with evacuations in the past when people were moved from, say New Orleans here to Missouri and had nothing with them. They were not aware of what medications they were on. They did not know what their diagnosis was. We tried to develop a system wherein we can have the medical information with the patient at the time of transition. Even the drug list that the nurse is carrying with her might be something that we can send with the patient when they transition. Security doesn't mean, just having them, in a place where we know they're away from the disaster or the zone of danger, but at the same time ensuring the security of their treatments, which will ensure how well they do and how well they feel.
To create your own emergency plan, start by placing someone in charge of coordinating preparedness planning. Larger facilities may even assemble a committee. If this is your job, you should begin by thinking about the space around you and how you would react to possible crisis. Consider emergencies that could occur within your facility. Then consider what could happen in your community. Think about how your staff and residents could handle a power outage, even one that lasts for days or even weeks. If your facility's critical information is computerized, do you have an uninterruptible power supply unit and a battery backup system that kicks in if you lose electricity? And how about if you lose your plumbing and your water supply? You probably already have medical information and emergency contacts for every person in your care, but this is a good time to double check. And where is that information kept? It is crucial that this information reside not only within your facility, but it also needs to be accessible in case of an evacuation. It's suggested that you keep this information handy on cards or documents, listing participants' full names, family contact information, birth dates, physicians, food and drug allergies, and information regarding any necessary medications or conditions.
We have people change day by day. We have people that go out to the hospital. We have people that are admitted every day, and it changes constantly. So what we're going to be implementing is to print our emergency contact list every week so that in case of an emergency, we have something that we can have at our fingertips every week that is absolutely accurate.
Along with your patient emergency information, you will need facility contact information for administrators and staff, as well as numbers for your local and state health department contacts, utilities, and points of contact for local hospitals. And be sure to update this at least twice a year to keep it current. Larger facilities may want to create a facility plot plan that shows the footprint of all of the buildings, utility connections, and outlets to nearby roads, along with a description of the campus and facility services. Once you have gathered all these documents together, you will want to put them into a comprehensive manual and keep it in an easy-to-find location. Larger operations need to have several copies and should make sure all staff know where they are so they can grab them quickly during an evacuation. Whether you are a large or small operation, there are two scenarios you must be ready to handle. One that covers the need to evacuate the building, and another for when you need to stay put. If you are asked to stay in the building, think ahead by preparing a few things ahead of time. First, you'll want to determine a safe room or rooms for everyone to gather. It should be an interior room with the fewest windows or vents and large enough for the designated group. It should also have emergency supplies and a landline telephone. Other emergencies might call for an evacuation of the premises, forcing everyone to gather at a meeting place outside. You should decide on two alternative locations, one nearby and one farther away. And once you have mapped out this evacuation plan, post it, showing at least two escape routes and the identified meeting locations. Then share a copy with families and local emergency officials. If your staff and residents are using multiple exits and meeting places, make sure you have the ability to communicate so that you can merge your roll call numbers for an accurate facility-wide head count. Keep in mind that some emergencies may simply call for an evacuation of your home or building, but others may require an evacuation of the entire neighborhood. Think about how you would get everyone where they need to go. You'll have to have some transportation lined up using volunteers, additional staff, or even neighbors. If you are contracting with an in-town transportation company, please know that you are not alone. Others have too. It's a good idea to work with an out-of-town transportation company. It's also a good idea to put some sort of name tag on each person being transported. That way they are easily identified by personnel at their final destination, and the correct emergency records will be associated with each resident. Whether you are evacuating or staying inside your building, there are some things you need to do in every crisis situation. Make sure staff know who they are responsible for and be aware of where everyone is at all times. Identify which clients or staff may require additional assistance during drills and actual emergencies. Think about how the people in your care will get their medicine and how you will attempt both vertical and horizontal evacuations without elevator service if the power is out. On the way out, staff should never stop to grab personal belongings. And whenever you are moving people in an emergency situation, be sure to count them often. It is critical to include local emergency officials in your planning and practice sessions. If they have a copy of your emergency plan ahead of time, they may have some great ideas to help you improve it. And they will be in a much better position to come to your rescue should a real crisis occur.
Elderly folks and people who might be disabled, they're always a high risk for us, and we're concerned about that. And anything we can do if we come in and we point things out, it's only for their safety and to keep them safe and to make our jobs a little bit easier when we arrive on the scene. When it comes down to an emergency, we've trained for them every day. It's something that these folks might not be used to.
We have expertise in many of the larger health departments with staff that are dedicated to doing this, and we can work with facilities and administrators in order to guide them and help them put together their own plan.
It's very important for these facilities to contact their local fire department or police department or EMS so that we have a designated person who's knowledgeable and knows what the fire department or EMS might be looking for when we show up on the scene of a disaster. When we show up, we want to know how many people they have in the building, how many people that may be able to walk, how many people in wheelchairs, how many people that may be bedridden.
When you're planning and preparing a plan, you need to think about the unthinkable as well as the things you're more comfortable with, like tornadoes and floods that happen fairly often in different parts of the country. One of these things, for example, is bioterrorism. And if a facility administrator works with a health department ahead of time, arrangements can be made to be sure that they're in the distribution chain for pharmaceuticals, antibiotics, vaccines, should they ever be needed. We would hope that once people see this presentation and learn about Ready in 3, that they would be motivated or feel free and not nervous about calling their local health department.
There are resources and people who can help you develop your own disaster plan. Contact the Planning and Development Unit within the Department of Health and Senior Services for more information. The second step in being prepared is to prepare an emergency kit. Large facilities will need several kits, and they all should be ready for the staff to grab and go in case your facility is evacuated in a hurry. Each kit ought to include your all-important emergency manual and copies of your emergency plan and facility contacts, residents' medicine and special consideration documents, and contact information for their loved ones. Kits should also be packed with first aid supplies, sanitary items, flashlights, portable radios, batteries, and two-way radios or cell phones. In addition to these evacuation packs, it's also a good idea to store emergency supplies in your designated safe room. Again, you'll need your manual with facility and resident information, a first aid kit, blankets, a battery-powered radio, flashlights, and extra batteries. And don't forget about personal hygiene and sanitation supplies like toilet paper, paper towels, wet wipes, and plastic bags. You'll also want to have enough non-perishable food and water to last staff and clients for at least 4 days. That's 1 gallon of water per person per day. This really should be commercial bottled drinking water and should be replenished at least once a year to keep it fresh. When it comes to the non-perishable food, consider food allergies and keep a supply of disposable bowls and utensils, along with a manual can opener. You may even want to include decks of cards, magazines, and other fun items to keep everyone busy and keep their minds off the crisis at hand. In general, you may want to consider installing carbon monoxide detectors in addition to the required smoke detectors. And be sure to check them often. Ensure that fire extinguishers are properly charged and easy to reach. You might even consider having a generator professionally installed and maintained for backup power. The final step to being ready in 3 is to listen for information. You can trust that our public officials have plans in place for these types of situations and are monitoring our safety 24/7. No matter what situation occurs or where it takes place in the state of Missouri, you can rest assured that the state is ready and waiting at all times. The DHSS Department Situation Room is the central location for monitoring and reporting potential problems 24 hours a day, 7 days a week. All local public health agencies, doctors, hospitals, and law enforcement know to call the emergency hotline anytime if they suspect there is a public health emergency or bioterrorism event. This computer system tracks the emergency rooms in hospitals all across the state, and folks here are constantly monitoring many different things, ready to determine when they have an emergency on their hands. Should a crisis arise, Missouri's Department of Health and Senior Services works with the FBI, Homeland Security, the State Emergency Management Agency, local police, and others, including the governor, to determine the best response. The state of Missouri has plans in place for all types of crises, and state officials have conducted many practice drills for everything from chemical spills to lots of people getting sick and needing medicine at one time. But no matter what type of emergency, a few things stay the same. The experts here always work with state and local law enforcement and also notify TV, radio stations, and newspapers.
PSR to OPI. Over.
That's why it's important for everyone to listen for instructions. It's good to know that local, state, and federal agencies have plans to protect and inform us all, but it is up to you to listen and respond. Equally important is your willingness to listen to the people in your care. Unfamiliar places, first responders, and activity that is not routine may be a little scary, so closely monitor their behavior during an emergency and during practice drills. And watch for the following signs of stress.
You do want to look for depression. You do want to look for people with a vacant gaze. You want to look for people who are getting, their respiratory rate is increasing. You want to look for people who are looking thirsty. Their mouth's looking dry. They're not able to speak. They're getting tearful. Those are normal reactions that can happen to a panic situation or a disaster. You want to anticipate that this is going to happen and make sure that you're making everyone comfortable, secure. Let them know that you're there for them and that, we're going to be doing a certain thing, and repeatedly telling them, this is where we're going. We're going to get in the bus, okay? There's been a little trouble. I think the important thing is reassuring people, letting them know what's happening, and then, keeping the familiarity of the environment intact. Many times we just assume that someone's got dementia or they've got cognitive impairment. They can't understand anything that's happening. And, fortunately, they do understand what's happening, and not all faculties of an individual are lost just because they have dementia. So we need to let them know what we're doing. Just, giving them hugs and touching them, that's important, because it's amazing how contact works, letting them know you're there, just holding their hand. They might not be able to understand your words, but how you touch them makes a difference.
Family and friends will be the best source of information on their loved one's likely reaction to a crisis. So again, it's important to discuss emergency preparedness with them. And remember, the people in your care will take their lead from you and your staff. So if you remain calm, so will they. Thinking and planning ahead is the best line of defense for any emergency. Take an active role in the safety of the people in your care by creating a plan, preparing a kit, and listening for information. And once you do, be sure to check your plan and your kit quarterly, and keep a log every time you do, so you'll know when to check it again. It's also important for you to encourage families on your staff to create their own family emergency plans. DHSS will be happy to send you copies of the Missouri Family Safety Guide and Family Plan to share with them. After all, the more prepared they are, the smoother things will go during a crisis at your facility. Meet with your neighbors to determine how you could assist each other in an emergency. And start developing personal relationships with local emergency officials, law enforcement, and public works personnel. These are the people who will likely respond to an emergency at or near your facility, and they can help you determine possible hazards or threats in your area. Communication is key to crisis control before, during, and after a disaster. So start immediately by sharing your plans with staff and families too. In fact, showing that you are prepared will likely make you a more marketable provider. It will certainly decrease your recovery time should an actual disaster strike. But most importantly, it can save lives. So remember to stay alert, because you can't predict when or where an emergency will happen, but you can be ready in 3.